Obesity has become one of the most pressing health challenges of our time, affecting over a billion people worldwide. This chronic relapsing disease is not just a matter of lifestyle, but a complex interplay of genetics, environment, and behavior. The consequences are staggering: millions of deaths each year, rising rates in nearly every country, and a global economic burden projected to reach $3 trillion by 2030. As obesity rates climb, so do related health issues like diabetes, heart disease, and more. Addressing this crisis requires more than individual willpower. It demands coordinated action, innovative treatments, and a shift in how we view and manage obesity. GLP-1 therapies, originally developed for diabetes, have emerged as a major innovation in obesity treatment. These medications work by mimicking a natural hormone that helps regulate appetite and blood sugar. By enhancing feelings of fullness and reducing hunger, GLP-1 therapies support significant weight loss and offer metabolic benefits. Their impact goes beyond the scale. They can also help manage conditions like high blood pressure, cholesterol, and even certain heart and kidney diseases. As research continues, GLP-1 therapies are becoming a cornerstone in the fight against obesity, offering hope to millions who struggle with this complex disease. Response to the growing obesity crisis, the World Health Organization has released a new guideline on the use of GLP-1 therapies for adults living with obesity. This guideline is based on the latest scientific evidence and aims to help countries accelerate their response to obesity. It emphasizes early diagnosis, integrated care, and the importance of combining medical, behavioral, and sometimes surgical intervention. The WHO's recommendations are designed to be adaptable across different health systems and to ensure that care is person-centered, equitable, and accessible to all who need it. WHO recognizes obesity as a chronic, relapsing disease that requires lifelong care. This means that managing obesity isn't about quick fixes or temporary diets. It's about ongoing support, early screening, and comprehensive management of related health issues. The guideline calls for regular monitoring, early intervention, and a combination of treatments tailored to each individual. By framing obesity as a disease rather than a personal failing, the WHO aims to reduce stigma and promote more effective, compassionate care. GLP-1 therapies target specific pathways in the body to help manage obesity. They act on the brain to reduce appetite, increase feelings of fullness, and slow down the emptying of the stomach. This combination helps people eat less and lose weight more effectively. Over time, these therapies have shown benefits not just for weight loss, but also for improving blood sugar control, reducing blood pressure, and lowering cholesterol. Their ability to address multiple aspects of metabolic health makes them a powerful tool in obesity management. WHO guideline recommends GLP-1 therapies as a long-term treatment for adults living with obesity. However, these recommendations are conditional, meaning they depend on individual circumstances, health system readiness, and available resources. Not everyone with obesity will need or benefit from GLP-1 therapies. The guideline stresses the importance of identifying those at highest risk, such as people with severe obesity or related health conditions, and ensuring they have priority access as supply and capacity grow. Medication alone isn't enough. The WHO strongly recommends pairing GLP-1 therapies with intensive behavioral therapy. This means structured support for healthy eating, physical activity, and regular counseling. Behavioral therapy helps people set realistic goals, track progress, and make lasting lifestyle changes. When combined with medication, these interventions can amplify and sustain weight loss, improve health outcomes, and empower individuals to take charge of their health journey. One of the biggest challenges in implementing the new guideline is ensuring that everyone who needs GLP-1 therapies can actually get them. High costs, limited production, and supply chain issues mean that only a fraction of people with obesity currently have access. The WHO emphasizes the need for fair, affordable, and universal access, especially for those at highest risk. Solutions include supporting generic production, tiered pricing, and integrating these therapies into primary care systems worldwide. GLP-1 therapies to make a real difference, health systems must be prepared. This means training healthcare providers, building strong supply chains, and ensuring that patients can be referred and followed up effectively. Digital tools and telehealth can help support adherence and empower patients. The WHO guideline calls for investment in workforce training, infrastructure, and monitoring systems to make sure that new treatments are delivered safely and effectively. The heart of the WHO guideline is a commitment to person-centered, non-discriminatory care. This means recognizing the unique needs, values, and preferences of each individual living with obesity. Care should be respectful, inclusive, and designed to empower people to participate in decisions about their health. By involving patients and communities in the design and delivery of care, health systems can build trust and improve outcomes for everyone. Rolling out the new guideline requires careful planning and prioritization. The WHO recommends starting with those at highest risk, such as people with severe obesity, diabetes, or cardiovascular disease, and gradually expanding access as supply and capacity improve. Transparent, evidence-based frameworks are needed to guide these decisions and ensure fairness. Ongoing research will help refine these strategies and inform future updates to the guideline. GLP-1 therapies are just one part of the solution. The WHO stresses that medication alone cannot solve the obesity crisis. A comprehensive system-wide response is needed, one that addresses prevention, care, and the underlying social and environmental factors that drive obesity. This includes policies to promote healthy food environments, urban design that encourages physical activity, and efforts to reduce economic and social inequality. WHO envisions a new ecosystem for obesity management, one that integrates medical innovation, prevention, and care across the life course. This ecosystem relies on collaboration among patients, providers, researchers, industry, and policymakers. By sharing power and responsibility, and by embedding obesity care within universal health coverage and national insurance plans, countries can ensure that everyone benefits from advances in treatment and prevention. Sustained progress in obesity management depends on ongoing research and innovation. The WHO highlights the need for studies on long-term safety and effectiveness of GLP-1 therapies, cost-effectiveness, and new delivery models. Next-generation treatments, combination therapies, and digital health tools are all on the horizon. By fostering collaboration and sharing best practices, the global health community can stay ahead of emerging challenges and ensure that solutions remain effective and accessible. Publication of the WHO guideline is just the beginning. Now, countries' health systems and communities must work together to turn these recommendations into reality. By ensuring universal, affordable, and sustainable access to obesity care, including GLP-1 therapies and beyond, we can change the trajectory of this global epidemic. The choices we make today will determine whether we achieve a more equitable, healthier future for all.